6 signs it's social phobia, not introversion. Social phobia, also known as social anxiety disorder, is a mental health condition characterized by an overwhelming fear of social situations. Many people mistake social phobia for introversion, but the two are quite different. Introverts are people who prefer to spend time alone or in small groups, whereas people with social phobia feel anxious and scared in social situations, regardless of the number of people present. Here are 6 signs that you may be experiencing social phobia and not just introversion. 1. Intense fear of social situations. People with social phobia experience an intense fear of social situations, even those that most people find enjoyable, such as parties or public speaking. This fear can be so overwhelming that it interferes with daily activities, such as going to work, school, or running errands. People with social phobia may even avoid social situations altogether to avoid feeling anxious and uncomfortable. 2. Physical symptoms of anxiety. Social phobia can also cause physical symptoms of anxiety, such as sweating, trembling, rapid heartbeat, nausea, and difficulty breathing. These symptoms can be so severe that they feel like a panic attack. People with social phobia may also experience stomach upset, diarrhea, and other digestive issues. 3. Fear of being judged or scrutinized. People with social phobia are often afraid of being judged or scrutinized by others. They may worry that others are constantly evaluating them and that any mistake they make will be noticed and criticized. This fear can be so intense that it can cause people with social phobia to avoid social situations altogether. 4. Difficulty making friends. People with social phobia may have difficulty making friends or maintaining relationships because of their fear of social situations. They may avoid social activities or be reluctant to initiate conversations with others. This can lead to feelings of loneliness and isolation, which can exacerbate symptoms of social phobia. 5. Excessive self-consciousness. People with social phobia often feel excessively self-conscious in social situations. They may be overly aware of their physical appearance, speech, and behavior, and may worry that others are judging them. This excessive self-consciousness can cause people with social phobia to feel anxious and uncomfortable in social situations. 6. Avoidance of social situations. Finally, people with social phobia may avoid social situations altogether to avoid feeling anxious and uncomfortable. They may skip social events or make excuses to avoid them. This avoidance can cause people with social phobia to miss out on important opportunities, such as networking events or social gatherings with friends and family. In conclusion, social phobia is a mental health condition that is often mistaken for introversion. However, people with social phobia experience an intense fear of social situations, physical symptoms of anxiety, fear of being judged, difficulty making friends, excessive self-consciousness, and avoidance of social situations. If you think you may be experiencing social phobia, it's important to seek help from a mental health professional. Treatment options include therapy, medication, and lifestyle changes. With the right treatment, people with social phobia can overcome their fears and lead fulfilling lives. Treatment for social phobia typically involves a combination of therapy and medication. Cognitive behavioral therapy, CBT, is a common form of therapy used to treat social phobia. In CBT, the therapist helps the individual identify and challenge negative thoughts and beliefs about social situations. The goal of CBT is to help the individual develop coping skills and strategies to manage their anxiety in social situations. Exposure therapy is another form of therapy used to treat social phobia. In exposure therapy, the individual is gradually exposed to social situations that they fear, with the goal of desensitizing them to their anxiety. Exposure therapy can be done in a group setting or one-on-one with a therapist. Medications such as selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines may also be used to treat social phobia. SSRIs are antidepressant medications that can help regulate mood and reduce anxiety. Benzodiazepines are a type of anti-anxiety medication that can help reduce physical symptoms of anxiety. Lifestyle changes can also be helpful in managing social phobia. Regular exercise, a healthy diet, and good sleep habits can all help reduce anxiety. Avoiding caffeine and alcohol, which can exacerbate anxiety, can also be helpful. If you think you may be experiencing social phobia, it's important to seek help from a mental health professional. Social phobia can be a debilitating condition that can interfere with daily activities and lead to feelings of isolation and loneliness. With the right treatment, however, people with social phobia can overcome their fears and lead fulfilling lives. In conclusion, social phobia is a mental health condition that is often misunderstood as introversion. People with social phobia experience an overwhelming fear of social situations, physical symptoms of anxiety, fear of being judged, difficulty making friends, excessive self-consciousness, and avoidance of social situations. Treatment options for social phobia include therapy, medication, and lifestyle changes. If you think you may be experiencing social phobia, seek help from a mental health professional to receive an accurate diagnosis and appropriate treatment. It's important to remember that social phobia is a common mental health condition, affecting approximately 7% of the population. It can be caused by a variety of factors, including genetics, environmental factors, and past traumatic experiences. While it can be difficult to live with social phobia, it's important to remember that it's a treatable condition. If you have a loved one who is experiencing social phobia, it's important to be supportive and understanding. Avoid judgment or criticism, and encourage them to seek help from a mental health professional. Be patient and understanding as they work through their anxiety and develop coping strategies. In addition to professional treatment, there are also self-help strategies that can be helpful in managing social phobia. These include deep breathing exercises, visualization techniques, and progressive muscle relaxation. Practicing mindfulness and meditation can also help reduce anxiety and increase feelings of calmness. Finally, it's important to remember that social phobia is not a weakness or a character flaw. It's a medical condition that requires treatment, just like any other health condition. With the right treatment and support, people with social phobia can overcome their fears and live fulfilling lives. In conclusion, social phobia is a common mental health condition that is often misunderstood as introversion. People with social phobia experience an intense fear of social situations, physical symptoms of anxiety, fear of being judged, difficulty making friends, excessive self-consciousness, and avoidance of social situations. Treatment options include therapy, medication, and lifestyle changes, as well as self-help strategies. It's important to seek help from a mental health professional if you think you may be experiencing social phobia, and to be patient and supportive of yourself or your loved one as they work through their anxiety. Remember that seeking help for social phobia is a sign of strength, not weakness. It takes courage to acknowledge that you need help and to take steps to manage your anxiety. With the right support and treatment, social phobia does not have to control your life. You can learn to manage your fears and enjoy social situations without anxiety. If you suspect that you or someone you know is experiencing social phobia, don't hesitate to seek help. A mental health professional can help you develop a personalized treatment plan to manage your symptoms and improve your quality of life.